Hi, Dr. Yass here. In this video, I want to discuss the decision to get a hip or knee replacement and the theoretical basis by which that decision is being made. This is not a discussion of medical. This is a discussion of the theoretical justification or rationale for the surgery. So for most of you, you end up having pain in the knee region if you're looking at a knee replacement, or you have pain in the groin area, the hip region, the butt, somewhere in there if you're looking at a potential hip replacement. And basically what happens is if you have pain in the region, an x-ray is performed. They're going to show you this picture, which shows a decreased joint space. They're going to tell you you're bone on bone, and that therefore the only way to resolve the pain that's in the area is to get the joint replacement. Now, basically, if we start with the concept of what the rationale is, they're trying to say that because pain is in the region and we found some level of arthritis, we will assert that the arthritis is the cause of the pain. That's known as correlative theory, junk science. I've talked about this to an endless amount. And basically the idea is that they're trying to make a correlation, not prove causation. And so by saying that it's correlation, they're simply saying the equivalent of if I open my front door when the sun rises, I can say opening my front door causes the sun to rise. The reality is that, first of all, if in fact the pain that you would experience would come from some sort of arthritic change in a joint, you could only have pain at the joint. And in most cases, the vast majority, 99.99999% of cases I've treated where someone was told they were bone on bone creating their symptom, their pain wasn't in the joint, it was in a surrounding area. Therefore, it was impossible that that symptom be coming from a structural variation of the joint. So that's the first step. Then you could look at the fact that studies showed as many people with no pain have the same type of structural variations, abnormalities of the joint as those with pain. So if it causes pain, how could you have as many people without pain having the same structural variations? So in terms of the use of the MRI, clearly it is a baseless mechanism. But that's what's used globally, and so that's what's used to try to coerce you into thinking that you need a surgery. Well, the failure rate for surgery is gigantic, and everybody knows somebody who's had a failed hip or knee replacement, in fact, gone on and had multiple revisions, or went on and then had some other type of joint replacement on the opposite leg, or more on the same leg, right? Everybody knows this fails. So with that in mind, it's very difficult to proactively push the idea that you need this joint replacement. And that's where the theory of surgery as a last resort came. That's where it came from. It's basically the idea of saying, listen, we have no confidence that this is going to work. But that's what we do for a living. We do surgeries. We replace joints. So we need to put you into a position to where it's slightly more appetizing than straight up front saying, well, we want to give you a joint replacement even though you've heard all these failure stories. So what we're going to do is we're going to coerce you into thinking, well, we'll try a bunch of other stuff, but when nothing else works, would you be willing to get the surgery as a last resort? Right? That's what you're being told. Listen, anybody who's had the conversation knows that this is what this is about. It's this idea that we'll try every possible. We don't really want to do surgery, even though we're surgeons. We're not bad guys or women. We're nice people. We don't really want to do this, but it's all that's left for you if you've tried everything else. So we'll try and give you some cortisone shots, and we'll try to give you some plasma therapy or stem cell therapy if you're really willing to be exotic and pay out of your pocket. Or you could try physical therapy or chiropractic. Try all this stuff. And when eventually it doesn't work, well, you want to get rid of your pain, and I am a surgeon, and that's the last thing I can offer you. So you get the surgery, right? So the premise of getting surgery as a last resort should be a red flag to you. Not from a medical perspective, from a logical perspective. The logic says that if they were so confident that the cause of your pain was this arthritic change, this supposed bone on bone, which is a fallacy in itself, which requires a separate video, but if that was, they would be adamant. They'd be like, listen, if you were my parent, and I had found this in them, I'd be telling them, I want to get my parents out of pain, right? Not make them suffer as long as they can't take it any further before they get to surgery. I'd be saying, I want you to have the surgery tomorrow. But they don't say that, right? That in itself should be a red flag. They're really not strong on this idea that this is going to work, so they have to coerce you with this idea of pain as a last resort. And it's very hard because they can't look to evidence, empirical data, to say, look, all these people have had this and all these people are walking around perfect and no one ever gets a revision and everyone's life is full and complete, because that's not real. So they've got nothing to look to in terms of evidence. People are much, much more hesitant now because of all the failure rates. So they've got to use this idea of surgery as a last resort. And the point of the video is to say, well, if it was so good and so effective and they were so sure, why wouldn't surgery be the first resort? That's the point of the video. And so the idea for you as the consumer, as the person whose body it happens to be, you have to take that into account before you think about getting that surgery. Because once you get the surgery, it's hard to reverse it, right? You can't really go back. So say to yourself, if they're saying that that surgery should be as a last resort, what does that say about the efficacy of the surgery and their confidence it's going to work? It should be a red flag to you. What really they should be promoting is surgery as a first resort, okay? Now, the last part of this title is surgery not as a result, right? They want to make surgery as a last resort. I'm saying, well, what about surgery not as a resort? And so the answer there is that, well, what if it's a muscular cause? What if the actual symptom you're experiencing, let's say in the hip region, in the groin region, is from the muscle called the sartorius muscle? Or in the butt area, it's called the piriformis muscle. Or maybe running down the side of your leg is the iliotibial band. Let's say that the actual tissue eliciting your pain was coming from a muscle, and yet you were found to have this arthritic change. Remember, lots of people were found to have it without having a symptom. So how do you know that you're not one of these people it's not creating a symptom with, and that your symptom is actually coming from another tissue? Right? Isn't that a possibility? This is just a logical presentation. You have to be open to logic. It is possible that you have arthritis that is not causing symptoms, and yet your symptom is coming from a tissue in the region of muscle. Right? Well, if you get surgery, how is that going to fix the muscular deficit? It's not. And therefore, in a case where it's muscular, surgery is not an option. So if you want to take the approach that the Yass method would promote, it's the idea of doing a physical evaluation. Forget the X-ray and MRI. We all know that's crap. It's ineffective. It's baseless. Let's do a physical evaluation. And if the physical presentation shows that the symptoms are coming from the joint, then surgery is a first resort. If it turns out, which I've proven it is in 99.99999% of cases, that the tissue eliciting the pain is muscle, then surgery is a not resort. There's no discussion of it. You're not getting the surgery. It doesn't matter the intensity of the pain, the level of dysfunction. If the physical presentation of your symptoms says your pain is muscular, you're going to have to work it out by doing the appropriate strengthening. And forget physical therapy. They don't even know what they're doing there, because they're doing their treatment based on the diagnosis from the referring physician, which was the orthopedist who said you're bone on bone. So that's what they're treating you for. This is Yass method exercise. Isolated strength training. Actually establishing which muscles are responsible for your symptom and then correcting it by doing isolated strengthening, providing progressive resistance, the ability to make the muscles stronger so they stop straining and eliciting your pain. All right? So the three choices are surgery as a first resort, surgery as a last resort, or surgery not as a resort. They should be promoting surgery as a first resort if they're so confident that it's going to work and that cause is structural. They don't. They use surgery as a last resort because it's the only way of coercing somebody into even considering the surgery. So the idea is to promote, let's just try everything else, and when nothing else works, well, maybe then you'll be willing to get the surgery. It's a coercion. It's clearly a coercion. Or the fact is that through a physical evaluation, we establish the cause is muscular. And in being muscular, surgery would be a no resort, a not resort, an anytime resort. Because surgery wouldn't fix the cause of your symptoms, which is muscular. So that's what this is all about. That's what this video is trying to get you to think about. Try to open your mind to a logical analysis of your situation and what the best course of action should be. All right? If this strikes a chord in your mind and you'd like to ask questions, you can contact me by email at drmitch@mitchellyass.com, drmitch at mitchellyass.com. If it struck enough of a chord that you'd like me to assist you in determining the cause of your pain, if it turns out it's muscle, which again it is in 98, 99% of cases, then we can provide you with a series of exercises, have you do them under my supervision. The sessions, the Zoom or Skype session that I would love to do with you is videotaped, so you have that going forward, and we help you get to the point of being pain-free and fully functional. So if you would consider that as an option and you'd like to make an appointment for a Skype or Zoom session, you can do so. Again, email me at drmitch@mitchellyass.com, drmitch at mitchellyass.com. If you like this video, it's making sense to you, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. All right, for now, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye for now.